If you think iron deficiency only shows up on blood tests, this is important, because your body often shows visible warning signs long before labs turn abnormal, and most people miss them. If you value clear, doctor-led health education that helps you catch problems early, please support this channel by subscribing. It truly helps this content reach more people, and I appreciate it a lot. Now let's get straight to the signs. Why iron deficiency is often missed. It starts quietly. Your body adapts, your energy slowly declines, your tissues get less oxygen, and your body begins to signal distress in visible ways. But because these signs develop gradually, people normalize them. What iron actually does. Iron is not just about blood. Iron is required for oxygen delivery to tissues, brain function, muscle endurance, immune strength, and skin, hair, and nail health. When iron is low, every system feels it. Why you can see iron deficiency. When oxygen delivery drops, the body prioritizes survival organs. That means skin, hair, nails, lips, and eyes often show changes first. These are not cosmetic issues, they are biological signals. Sign number 1, pale skin or loss of color. One of the earliest visible signs is paleness. Not just the face, but inner eyelids, gums, lips, and palms. Reduced iron means less hemoglobin. Less hemoglobin means less color. People often think this is aging or genetics. It's often iron-related. Sign number 2, dark circles or a tired look. Low iron reduces oxygen to facial tissues. This can cause dark under-eye circles, a constantly tired appearance, and dull skin tone. Even with enough sleep, the face may look exhausted. This is a circulation issue, not just fatigue. Sign number 3, cold hands and feet. Iron deficiency reduces oxygen delivery. That makes it harder to maintain warmth in extremities. People notice cold hands, cold feet, and poor tolerance to cold. Why these signs matter? These are early warnings. Catching iron deficiency early is far easier than treating it late. Ignoring them allows deficiency to progress to severe fatigue, shortness of breath, heart strain, and immune weakness. Important reassurance. Seeing these signs does not mean something terrible is happening. Iron deficiency is common, it's often reversible, and it's manageable when identified early. What this series will cover. In this 9-part series, you'll learn all 17 visible signs of iron deficiency, which ones appear first, who is most at risk, and when to get tested. This is about awareness, not fear. Your body speaks before it collapses. Iron deficiency whispers before it screams. One of the clearest ways iron deficiency shows itself is through hair, nails, and skin. These tissues are not essential for survival, so the body diverts oxygen away from them first. Changes appear here early. Sign 4, hair thinning or excessive shedding. Hair follicles need oxygen. When iron is low, strands become thinner and shedding increases. Low iron reduces nutrient delivery. People often notice more hair on pillows, brushes, or drains. This is frequently blamed on stress or aging, but low iron is a common cause. Sign 5, dry, brittle, or dull hair. It loses shine and breaks easily. Conditioners don't fix this. The problem is internal. Sign 6, brittle or spoon-shaped nails. Iron deficiency affects nail structure. They may become thin, brittle, or curved upward at the edges, the classic spoon-like shape. When present, it's significant. Sign 7, slow nail growth. Nails grow slowly, look weaker, and peel easily. This reflects reduced oxygen delivery. Sign 8, dry or pale skin. Low iron reduces blood flow to the skin. It may appear unusually pale, dull, dry, or less elastic. This is often mistaken for aging, but it's often iron-related. Why are these signs missed? Because they develop gradually. People adapt and change products, but hair, skin, and nails are early messengers. Listen to them. Not every problem means low iron, but when multiple signs appear together, iron should be considered. Patterns matter more than single findings. Who should pay attention? Iron deficiency doesn't look the same in everyone. It's especially common in women, seniors, and those with digestive issues. Early detection prevents severe fatigue. Closing part 2. Hair, nails, and skin often show iron deficiency before fatigue becomes severe. Listen to these early messengers to stay strong. We'll see you in the next part. Stay informed and stay proactive. Your health depends on understanding these internal whispers. Take care of your body. Iron deficiency doesn't only affect energy. It often shows up inside the mouth and on the face, places many don't expect. These signs are powerful because they reflect direct tissue oxygen loss across your most sensitive areas. Awareness is vital. Sign number 9 is one of the clearest, pale inner eyelids. Doctors often check this during clinical exams. Gently pull down the lower eyelid. Healthy tissue looks pink or red. With iron deficiency, it may appear almost white. This paleness directly reflects low hemoglobin levels and significantly reduced oxygen delivery to your vital tissues. Sign number 10 is pale gums. While people often assume this is dental-related, oxygen supply plays a major role. Healthy gums are pink and vibrant. Iron deficiency can cause them to look washed out or unusually pale. Pay attention. Taking a moment to check your gum color in natural light can provide an early signal of your internal nutrient status. Sign number 11 involves the tongue. It is highly sensitive to nutrient deficiencies and shows changes fast. Low iron can cause the tongue to appear smooth, lose its normal texture, look swollen, or even feel painfully sore. If you notice a sudden change in how your tongue feels or looks, it is a strong sign that your iron levels need evaluation. Sign number 12 is painful cracks at the corners of the mouth. These are often misattributed to simple dryness. These sores may heal slowly, reopen frequently, or sting. Iron deficiency weakens your body's natural tissue repair systems. Persistent cracks that don't respond to standard topical care are a sign that your system needs internal support. Consistency matters. Sign number 13 is facial paleness, or a drawn appearance. Low iron reduces vital blood flow to your face. Even with adequate sleep, your face can look exhausted. This is not just cosmetic, it is a sign of circulatory stress. Paying attention to subtle shifts in your natural skin tone can reveal deep changes in your body's iron and oxygen levels. Why does the mouth show iron deficiency so early? Because mouth tissues renew extremely quickly compared to other tissues. When oxygen delivery drops, changes appear fast in these high renewal areas. They provide an early window into your health. One symptom alone doesn't confirm deficiency, but multiple signs together raise concern. Always look for clinical patterns. These signs are common in those with chronic fatigue or restricted diets. Awareness is your first step toward recovery. Your mouth and face often reveal iron issues long before lab results change. Listen to your body's early messages. Power. Recognizing these oral signals can transform your longevity. Thank you for continuing this iron series with us. Stay informed. Invest in your structure, and you invest in your future. We'll see you in part 4. Stay strong and healthy. Iron deficiency doesn't just affect how you look. It affects how blood moves through your body. That means your hands and feet often show signs early. Sign 14, cold hands and feet. One of the most common signs is feeling cold easily. Low iron reduces oxygen delivery, and the body prioritizes vital organs first. Hands and feet lose warmth. This is often iron-related. Sign 15, pale palms or nail beds. Healthy tissue looks pink. With iron deficiency, it may appear pale, washed out, or less red than normal. This reflects reduced hemoglobin levels. Look at the palms of your hands or the base of your nails. Sign 16, poor circulation appearance. Some notice bluish or pale fingers or slow color return after pressing the skin. This shows reduced oxygen delivery to tissues. Sign 17, swelling or puffiness in hands or feet. Iron deficiency can affect blood flow and fluid balance, leading to noticeable changes over time. Mild swelling, puffy fingers, or foot discomfort may occur. This is not always dramatic, but noticeable. Why are these signs often blamed on aging? People assume it's just the weather or age. But iron deficiency often develops slowly, making it easy to dismiss. Not every issue is iron-related, but when signs appear together, iron should be considered. Who is most at risk? These signs are common in seniors, women, and individuals with poor absorption or chronic illness. Iron deficiency does not discriminate. What should you do? Do not self-diagnose. Note the pattern and discuss it with your doctor. Ask about iron testing. Early evaluation prevents complications. Closing for part 4. Hands and feet often reveal deficiency first. They show signs before the heart or lungs are affected. Listen to your body's early messages to maintain your long-term health. We'll see you in the next part. Your hands and feet are communicating important information. Stay informed and stay proactive. We'll see you in the next part of our series on understanding your health. Stay informed and stay strong. Your health depends on understanding these internal whispers. Take care of your body. Iron deficiency doesn't just affect muscles and skin, it also affects the brain and nervous system, and that means the eyes and visual processing often show signs early. Why iron affects the brain and eyes? Iron is essential for oxygen delivery to brain tissue, neurotransmitter production, and nerve signal transmission. When iron is low, the brain works harder with less oxygen. That creates visible and noticeable effects. Sign number 18, dark circles or shadows under the eyes. Low iron reduces oxygen delivery to facial tissues. Blood vessels under the eyes become more visible. This causes dark circles, shadowing, or a sunken appearance. Even with good sleep, these may persist. Sign number 19, frequent eye fatigue. People with iron deficiency often notice eyes tire easily. Discomfort after reading and difficulty focusing visually. This is not always vision-related. It's often oxygen-related. Sign number 20, blurry or dim vision. Iron deficiency can reduce oxygen to the retina and optic nerves. This may cause brief blurred vision, dimness, or difficulty adjusting to light changes. These episodes often come and go. Sign number 21, dizziness or lightheadedness. This is one of the most common neurological signs. Low iron means less oxygen to the brain. People may feel dizzy when standing, lightheaded, or off balance. This is often blamed on dehydration or blood pressure. Iron deficiency is a frequent cause. Sign number 22, headaches or pressure sensations. Reduced oxygen delivery can trigger tension. These can be pressure around the temples or dull discomfort. These headaches often improve temporarily with rest. Why these signs are missed? Because they're non-specific. People assume eye strain, aging, stress, or screen use. But when combined with other signs, iron deficiency should be considered. Important clarification. Eye or neurological symptoms alone do not confirm deficiency. Always look at the whole picture. Who should be extra careful? These signs are especially common in seniors. People with low blood pressure, those with chronic fatigue, and individuals with poor iron absorption. Iron affects the nervous system deeply. Your eyes and brain are sensitive to oxygen changes. Iron deficiency often shows there early. See you in the next part. Iron deficiency doesn't just change how you look, it changes how you move. Many signs are visible in your daily behavior. These are subtle shifts that most people overlook, but they tell a powerful story about your body's oxygen status. Iron is essential for oxygen delivery to muscles. When oxygen is limited, muscles fatigue faster and movement becomes inefficient. The body compensates for this lack of oxygen, and those compensations are visible to anyone paying close attention. You may notice a constant look of fatigue, slumped posture, slower movements, or a heavy appearance even at rest. This is not laziness. It is a direct physical result of reduced oxygen availability in your system. Another visible sign is slower walking or shorter steps. Low iron significantly reduces your muscle endurance. People may walk more slowly, avoid long distances, or stop more often to rest. This often develops gradually. Because it happens over time, it's rarely noticed right away, but it is a key indicator of your metabolic capacity. When muscles fatigue easily, posture suffers. You may notice poor posture or shoulder drooping. Rounded shoulders and forward head posture are common. This is often blamed on aging, but iron deficiency contributes. Difficulty standing upright for long periods is a sign that your postural muscles aren't getting the fuel they need. Activities that used to be easy may now look effortful. Climbing stairs, carrying groceries, or standing from a chair. People may pause, brace themselves, or move more cautiously. These are physical signs of reduced oxygen delivery. Notice if you or a loved one are bracing more often or moving with hesitation during simple daily movements. You may also notice resting more frequently, sitting more often, leaning on furniture, or avoiding standing tasks. This is your body trying to conserve oxygen. It is a biological strategy to protect vital organs when resources are low. If you find yourself leaning on counters or furniture more often, it's a sign to check your iron levels. Why are these signs misinterpreted? People think I'm out of shape, I'm getting older, or I just need sleep. But when these movement changes appear alongside skin or circulation signs, iron deficiency becomes much more likely. These changes can have many causes, but iron deficiency is one of the most common and reversible. Awareness matters. Unlike many age-related declines, iron-related fatigue can often be significantly improved with proper treatment. Your body shows iron deficiency not just in appearance, but in how it moves through the world. Listen to your movement. Recognizing these physical signals can transform your vitality. Thank you for continuing this iron series with us. Stay informed, invest in your structure, and you invest in your future. We'll see you in part 7. Stay strong and healthy. Iron deficiency doesn't only affect the body, it often changes behavior. And some of the most telling signs are habits people feel embarrassed to mention or don't realize matter. Low iron reduces oxygen delivery to the brain. When the brain lacks oxygen, focus decreases, impulse control weakens, and unusual cravings appear. The brain looks for ways to compensate. One of the most specific signs of iron deficiency is craving non-food items, or pica. This includes craving dirt, clay, or chalk. Craving ice, called pagophagia, is especially common. This is not psychological. It is strongly linked to iron deficiency. Chewing ice may briefly increase alertness or blood flow to the brain. Persistent ice craving is a red flag. Sign: restlessness. Some fidget constantly or struggle to sit still, often mistaken for anxiety. Iron plays a role in dopamine and nervous system balance. Low iron also affects mood and frustration tolerance. This can cause irritability, emotional flatness, or mood swings. These changes are biochemical, not character flaws. Another visible sign: brain fog and slow thinking. People may appear distracted or mentally slow. This is not cognitive decline. It's often oxygen deprivation. These signs are often missed because they don't look medical. People think it's just stress or personality, but when combined with physical signs like pale skin or fatigue, they are meaningful. Behavioral signs are common in women and seniors. Iron deficiency affects the brain earlier than many realize. Don't self-diagnose, but do note the pattern and discuss it calmly with a healthcare professional. Early changes are contextual. Your habits and cravings may be your brain asking for oxygen. Listen early to avoid complications. Awareness is proactive. Closing for Part 7. Your habits and cravings quietly reflect what's happening inside. When iron is low, your brain often shows it early. Listen to those signals. Stay informed and stay proactive. Your health depends on understanding these internal whispers. We'll see you in the next part of our series. Iron deficiency doesn't just change how you look, it changes how you move. Many signs are visible in your daily behavior. These are subtle shifts that most people overlook, but they tell a powerful story about your body's oxygen status. Iron is essential for oxygen delivery to muscles. When oxygen is limited, muscles fatigue faster and movement becomes inefficient. The body compensates for this lack of oxygen, and those compensations are visible to anyone paying close attention. You may notice a constant look of fatigue, slumped posture, slower movements, or a heavy appearance even at rest. This is not laziness. It is a direct physical result of reduced oxygen availability in your system. Another visible sign is slower walking or shorter steps. Low iron significantly reduces your muscle endurance. People may walk more slowly, avoid long distances, or stop more often to rest. This often develops gradually. Because it happens over time, it's rarely noticed right away, but it is a key indicator of your metabolic capacity. When muscles fatigue easily, posture suffers. You may notice poor posture or shoulder drooping. Rounded shoulders and forward head posture are common. This is often blamed on aging, but iron deficiency contributes. Difficulty standing upright for long periods is a sign that your postural muscles aren't getting the fuel they need. Activities that used to be easy may now look effortful. Climbing stairs, carrying groceries, or standing from a chair. People may pause, brace themselves, or move more cautiously. These are physical signs of reduced oxygen delivery. You may also notice resting more frequently, sitting more often, leaning on furniture, or avoiding standing tasks. This is your body trying to conserve oxygen. It is a biological strategy to protect vital organs when resources are low. Why are these signs misinterpreted? People think, I'm out of shape, I'm getting older, or I just need sleep. If you find yourself leaning on counters or furniture more often, it's a sign to check your iron levels. But when these movement changes appear alongside skin or circulation signs, iron deficiency becomes much more likely. These changes can have many causes, but iron deficiency is one of the most common and reversible. Awareness matters. Unlike many age-related declines, iron-related fatigue can often be significantly improved with proper treatment. Your body shows iron deficiency not just in appearance, but in how it moves through the world. Listen to your movement. Recognizing these physical signals can transform your vitality. Thank you for continuing this iron series with us. Stay informed. Invest in your structure, and you invest in your future. We'll see you in Part 7. Stay strong and healthy. By now, you've seen something important. Iron deficiency doesn't start in the lab. It starts in the body, and the body often shows signs long before anemia appears on a blood test. The most important takeaway: seeing one sign does not mean you are iron deficient, but seeing patterns matters. When multiple signs appear together, skin changes, hair thinning, fatigue, cold extremities, cravings, or brain fog, iron deficiency should be considered. Awareness is not diagnosis. It's the first step. What you should do if you recognize these signs. First, don't panic. Iron deficiency is common, manageable, and often reversible. Second, Don't self-diagnose or self-treat aggressively. Iron supplementation without testing can be harmful. The right step is evaluation. When to ask for testing? You should talk to a healthcare professional if you recognize several signs. If you feel chronically fatigued without explanation, have hair loss plus cold sensitivity, crave ice, or feel dizzy frequently, ask specifically about ferritin, iron levels, and hemoglobin. Ferritin is especially important for early deficiency. Why normal results don't always end the conversation. Iron deficiency exists in stages. You can have low iron stores, normal hemoglobin, and real symptoms. This is called iron deficiency without anemia. It's real, and it matters. If symptoms persist, further evaluation is reasonable. What not to do. Do not take high-dose iron supplements without guidance. Iron balance is precise. Too little is harmful. Too much is also harmful. Guidance matters. What recovery of iron status looks like. People often notice better energy and warmer hands and feet, improved focus, healthier hair and nails, and stronger tolerance to activity. These improvements often happen gradually, but clearly. Final reassurance, iron deficiency is not a personal failure. It reflects demand exceeding supply, absorption issues, life stages, or chronic stress. When the cause is identified, the solution becomes much clearer. Final message, your body speaks before it breaks down. Visible signs are not cosmetic, they are communication. Listening early protects long-term health. Thank you for following this series. If this series helped you, please like and subscribe to support this channel. It helps me continue creating calm, doctor-led health education. Share this with someone who needs to hear it.